One of the big things that we saw going back to the data and going back to the educational foundation and its contributions to patient safety, aside from aesthetics, aside from plastic surgery, aside from the journal, just the contribution that the Education Foundation has made to patient safety over the years is really incredible. You mentioned data-driven healthcare has been sort of the metric for, you said, I think for like 10 years. Well, we were very, very fortunate that our board had the foresight to put in our data collection in 2001, so we were well ahead of the trend, and we were able to aggregate the data. But looking at the data, looking at compliance data when we look at people's compliance and performance on survey, and then looking at patient concerns, what I see when I look at all that data sort of in parallel is patient concerns are, when I go to an outpatient setting, is it going to be as sterile? Is it going to be as safe? Can they respond if there is an emergency? Or is this just a doctor's office where they're doing the best they can? And then when I look at the actual compliance data and the data from our patient safety data reporting, what we see is lapses in sort of infection control and documentation. And I think those all go across all specialties, whether it's plastics or urology or gastroenterology, which are other big specialties that we accredit a lot of. Those are, I think, the sort of nexus of concerns and the nexus of risk factors that we've encountered.